So the shoulder joint is a ball and socket joint. And so the shoulder has a ball on the top of the humerus and a socket on the shoulder blade. So this would be my right shoulder. And it works like that. Normally, the shoulder has smooth, shiny white cartilage right over the ball and smooth, shiny white cartilage on the socket. And that makes for a nice gliding surface. In osteoarthritis, the surface cartilage wears thin. And sometimes it wears all the way down to bare bone. This area here would be a depiction of what bare bone would look like. So that causes pain because all the nerve endings are in the bone, not in the cartilage. So when a person has arthritis, they might feel creaking and grating in the shoulder, pain with range of motion and use of the arm. And that's where we begin the treatment when people have pain. There's nothing we can really do to cure osteoarthritis. We can't really put brand new cartilage back on there to any effective degree. So all we do is treat the symptoms. And as we discussed, that can be pills like anti-inflammatories, cortisone shots right into the joint to help with the inflammation. But then sometimes those modalities don't really take care of the pain, and we end up needing to do surgery. So surgery for arthritis usually involves artificial joint replacement or total shoulder arthroplasty, which just means replacing this arthritic ball and arthritic socket with metal and plastic. So during the surgery, we would cut about a tablespoon of bone away of the head, and then we put a metal shaft down the center of the bone, right through the center, and then there's this ball that's made of metal, and that goes on, and that's your new ball. On the socket side, we use a reamer, and we ream away the arthritic bone, and then we put this tiny little plastic component. It's got some pegs on the back, and we use a little bone cement, and we drill it in and place it there, and the cement holds it in place. So then your new joint is metal on plastic, and that takes away the pain. It's a very effective operation for pain relief. It isn't going to make you 20 years old again. It's not going to make you go out there and do 100 push-ups or climb trees. It's not really used for heavy laboring. It's kind of used for pain relief and to get you back into your activities of daily living. So we just discussed how doing a shoulder replacement is done for shoulder arthritis. And that's the standard, what we call anatomic shoulder replacement, replacing a ball with a ball and a socket with a socket. Now, over the last 20 years, there's been another type of shoulder replacement called a reverse replacement. And there are special situations when we do a reverse shoulder replacement. Basically, we flip-flop the ball and socket. There used to be a ball on here, so we make it into a socket. There used to be a socket here, and we make it into a ball. It seems kind of silly to do something like that, but there are reasons. And the reasons we do it is if someone has arthritis and a non-repairable rotator cuff tear. Remember that the rotator cuff, those are the muscles that give you the strength to use your arm away from the body. Sometimes people tear the rotator cuff and we fix it. Other times people tear the rotator cuff and they ignore it and they don't want to see the doctor, and then all of a sudden the rotator cuff becomes so torn you can't fix it. In that case, if they have a torn rotator cuff that we can't fix and they're a little older, maybe over 60, or if they have arthritis and a rotator cuff tear, we would do this reverse replacement. When people have their shoulders replaced with the ball and socket, they generally spend one night in the hospital. It's not a painful procedure. We do a general anesthesia. They have a nerve block, so that means that the anesthesiologist will numb up the nerves around here, and that gives you pain relief right down your arm for like 24 hours. So people don't need much pain medicine after a shoulder replacement. If we do the standard anatomic ball and socket replacement, surgery, we start physical therapy right away. You do have to wear a shoulder mobilizer for about 6 weeks with that operation. If we do the reverse replacement, the therapy protocol is a little different. You still spend 1 night in the hospital, but you wear a shoulder immobilizer to keep your arm against your side for the first 4 weeks. After that, we do the physical therapy.